Hi, welcome everybody. It's me, Dr. Khaled Sadek. You've joined in to a virtual global clinic. These are scheduled clinics that we run through live streams, and we talk about set topics as well as taking questions from our global audience. For those, if you're not familiar with myself, I'm Dr. Khaled Sadek, and I host my YouTube channel on cysts and lipoma removal primarily, but as a general physician, I can also give lots of advice on a whole raft of medical conditions. Today's chosen topic is thyroid disease. A lot of people have called in and wanting information about thyroid disease as a whole. So I thought today we talk a little bit about thyroid disease, talk about some of the videos that we've been doing, talk about the video that we're going to release, as well as do our big shout out to all our audience around the world. For those of you not familiar, thyroid is a gland that sits here in the throat, and its primary function is to produce a hormone called thyroid or thyroxine. This particular hormone is used to regulate a lot of different things in the body, primarily metabolism, energy levels. It can affect your mood, your sleep, your bones, and your gut. So when we talk about diseases of the thyroid, we typically classify them into two groups. Those where your thyroid is overactive and those where your thyroid is underactive, otherwise what we call hyperthyroidism and hypothyroidism. If we take the first one, for instance, we take hyperthyroidism, what we're saying is that the thyroid gland is producing too much thyroxine. How does the thyroid know how much thyroxine to produce? Well, inside the brain is a hypothalamus, another gland which produces something called TSH, thyroid stimulating hormone. The great thing about the thyroid gland is all the hormones are really labeled around what they do. So the TSH, the thyroid stimulating hormone from the hypothalamus, is there to stimulate the thyroid gland to produce the thyroxine, the actual bioactive ingredient. In hyperthyroidism, the brain is telling the thyroid gland to produce way more active thyroxine than your body needs. More importantly, the T4, T3 levels will be very high, way above the normal limits of about 21. But what does this mean for the individual? Well, individuals with a hyperthyroid gland may notice symptoms that are associated with having too much thyroxine. We know that the thyroxine gland will stimulate metabolism, so those with hyperthyroidism will notice that they're burning more, so they're losing weight. They've got a heat intolerance, like they're always feeling hot. It's also there to make people get more active and get up and go, but if you have too much of that, you become anxious. You may suffer from palpitations and anxiety. It can also cause hair thinning and irritable bowels. So when we have too much thyroxine, we get an overdose of all the things that the thyroxine gland does. So that's the hyper. Now the hyper can be caused through what we call Graves' disease, which is an autoimmune disorder where you have autoantibodies that are specific to thyroid stimulating hormone receptors in the thyroid gland. That is to say, your own body is triggering the thyroid to produce the thyroxine as opposed to the brain. So it's no longer modulated by TSH. Your body just detects the thyroid gland as being something it needs to attack, and it produces antibodies that actually attach themselves to TSH receptors, and it causes the hyperthyroidism. So there we go. Also, a classic feature that you notice in hyperthyroidism is that people are feeling very, very anxious and very, very alert. And often you can see the sclera of their eyes. Their eyes almost appear like they're protruding, what we call exophthalmos. And that's the eyes coming, bulging out. So you get this kind of like wide-eyed appearance. Now, the flip side of that is what we describe as underactive thyroid, so hypothyroidism. Now, hypothyroidism, as you would suggest, would mean that the brain is telling the thyroid to work, but the thyroid isn't producing the output. So when you look on a blood process, you'll notice that the TSH, the thyroid stimulating hormone, is high. It's going like the clappers. The brain is telling the thyroid to keep producing thyroxine. But the T3, T4 levels, the thyroxine levels, are absolutely in your boots. And so while we saw in the they're losing weight, we see the opposite of that in hypothyroidism. So people tend to be lethargic. Their metabolism is low, so they're actually cold intolerant, so they're always feeling a little bit cold. They also put on a bit of weight. They can also have hair thinning, and it can also affect your bones. So there we have it, the symptoms for overactive and underactive. Now, the causes for an underactive could be something like Hashimoto's. Now, Hashimoto's is, again, autoimmune disorder, but this time, instead of stimulating the thyroid to produce thyroxine, it actually goes about destroying the thyroid itself. So in Hashimoto's disease, you get underactive thyroid, and that causes the destruction of the thyroid. In both conditions, we treat it with medication in the large proportion of people. If we look at hyperthyroidism, we want to be able to reduce the thyroxine levels, and so we can either knock out the entire thyroid gland by issuing a medication like carbimazole, where we bring the T3, T4 levels to 0, and then we supplement that individual with a synthetic thyroxine like levothyroxine. We can also give them iodine radiation as well. In individual where we have a hypothyroid, we have to supplement them with the levothyroxine, that synthetic thyroxine. Now, synthetic thyroxine comes in many, many doses, but you typically start about 50 micrograms, and you can go up to 200 micrograms. And your GP, your family, your regular physician will be able to titrate your medication according to the response. Typically, he'll be looking at your T3, T4 levels in conjunction with the TSH. We'd want to see that your T4 levels are normal, and we'd want to see that the brain is recognizing that and the TSH levels are appropriate. So that was a quick, succinct overview of underactive and overactive thyroid disease. If you've got questions about thyroid disease, put them in the comment section. We'll happily take them. So in the next episode, we'll be talking about gut disease and gut flora. So stay tuned in for Friday. So let me go to the audience. Let's say hello. Let's see everybody's in. If you've enjoyed the chat so far, I know 44 of you have. The other 40, hit the like button, and we'll be happy to have your. We're not sure about the editing process. We're having a little bit of IT difficulty, but we've got a great big massive pile assist. You can have a preview of the thumbnail of that pile assist on my Facebook page, Dr. Khaled Sadek, or my Instagram account, Dr. Khaled Sadek. So if you're on social media, make sure you follow me on Facebook and Instagram so that you're ahead of what's going to come next. Don't forget, if you're watching this and you're thinking you would like medical treatment, then reach out to me at drkhaledsadek.com, or if you've got a skin complaint, that's lipomycyst.com. You can also find me on Instagram, Facebook, and Twitter. We're doing the global virtual clinic every Wednesday, Friday, and Sunday, and that's where I'm open to you, my audience, to part my medical knowledge free of charge all over the world. So we'll be treating as many people as we can, educating people about all the medical illnesses that are plaguing our modern life. So let's scroll through. Let's say hello to all the people we have on board today. Let's have a look. Let's go straight up to the top. So in at number 1, remember we do the podium positions. We've got the 3 positions for those who managed to log on first. So in at number 3, we've got Donna Adams. She's from Oklahoma City. She's wishing everybody a wonderful evening. Thank you, Donna, for logging in 3rd position. Margaret May, she's wishing everybody well. She's enjoying the show. And Debbie King is at number 1. Debbie King, a new pole position contender. Well done, Debbie, for getting in at number 1. Louise Cook, she's saying that she sat up after waking up to a flooded basement. Louise Cook, I hope you're well. Let me know where you are in the world. Caroline Tomtom from Wales is saying hi. Margaret May is saying her condolences to Louise Cook. Donna King, finally a break from the heat wave in California. That's good to hear. It's 86 degrees Fahrenheit, so it's cooling off. It's good to hear. I know the fires were really, really bad. Lauren Bauer says, Dr. Sadek, I love your videos. I have 2 nodules on my thyroid. One's about 2 centimeters. The other one, the doctor said, is about the size of a golf ball, and they won't remove them. Why? That's a good question. Often, they would need to do an ultrasound to see the kind of nodule it is. And they may even want to take a biopsy, otherwise known as an FNA, fine needle aspiration, or a biopsy of what that swelling is. The most common are simple cysts, and they're pretty benign, and so they tend not to away. There is also a condition known as a goiter, which is a large thyroid tissue. So it depends what it is. It's difficult to say. Although it may look enlarged, it may be benign and safe to leave. But I think if it's 2 centimeters and is growing, then certainly worth getting excised. So do reach out to your local surgeons. Vicky Howard, welcome. Donna Adams, really looking forward to educational portions and loving the pops and travel as well. If you've got it all here, you've got the education, you've got the pops, and you've got the travel. It's like the full house. Sherry S, how are you doing? She's wishing everybody a wonderful evening. Anna Brooks, her daughter has Hashimoto's from Riverside in California. Anna, do tell us more. Sandra Flynn from Ohio, welcome. Louise Cook, hot and humid in Atlanta, and that's where they've got the flooding. She doesn't have thyroid disease anymore. They removed it about 20 years ago, but she does continue the ramifications from that. Tell us more. Let's have a look. We've got Dawn Wheeler. Doctor, hi. I had hypothyroidism for about 20 years, and the last 8 years, the fatigue is overwhelming. Medication checked out okay. Why is it? Can't even get out of the bed in the morning. Well, you're absolutely right. So our metabolism does tend to tail off after the age of 30, and it drops quite significantly every decade on. So you may need that. You actually need to increase your thyroid a little bit more, even if the levels are normal, just to give you that extra boost. So that's certainly something checking with your physician. You may, although appear to be in the normal range, you may want to be in the top quartile. So you want to be up the top end of the normal range as opposed to the bottom end. So there may be a little bit of a tweaking there of your levothyroxine dose, but do check it out with your physician. Pauline Warren, welcome. She's welcomed everybody around the globe. Awesome. Gail Sharp, she's looking forward to the virtual clinic and chat, and she's from East Texas. Bridget Schumacher, not fair. I wish I could join. Hi, everyone from Arizona. Welcome, Bridget. Shame we can't have you on fully. Donna says, would love to travel, but she's enjoying the show. So we're going to bring her all the travel to her YouTube channel. That's brilliant. My thyroid and my diabetes suffer with confusion, says Caroline Tonton. Thyroid shows signs of overactivity, but is underactive. My body can't process insulin correctly. I was born with this. I was born under the sign of double confusion. Well, look, it's not unusual to have diabetes. If you're finding that your levels aren't being optimized, then like I said in the last clip, it may be that you wish to just optimize it within the top quartile or the top half of a normal range, as opposed to settling. So I would say you want to treat the numbers. You want to treat the symptoms as opposed to the numbers. So you want to treat the patient as a whole. Sid G, hello everybody. This is a hump day, the global virtual clinic through a Wednesday. Should be very interesting. I know nothing about thyroid and she's here to learn. Absolutely. Wednesday is the hump day. So hopefully we're going to get through this. Louise Cook, double whammy. Absolutely. She's saying double whammy to Caroline. I swear hyperthyroid right now is causing a havoc. Oh, that's a shame. That is a shame. Sharon Edelman, she's wishing everybody a wonderful evening. She's never had one of these global clinics before, so this should be really interesting. I hope the information was relevant and exciting. Let me know if you enjoyed the format. Let's see who else we've got in town. We've got Irani from Brazil. Welcome. Who else do we have? Alessandro from Sao Paulo. Welcome. Marion, welcome. I think from Italy. Let's have a look. Let's scroll down. So Marion says, I've type 2 diabetes for 54 years, and I have thyroid disease as well. Are the two related? Well, yeah, I think there is going to be a correlation in terms of hormone diseases. You know, pancreas is an insulin and the thyroid is an insulin. And it may be that they are related. But certainly there's going to be a correlation there. Jane Patson from Cape Breton from Canada. Welcome. Julia Erickson from Florida. Sulilali from London. Dr. Sarah is in the house, our resident orthodontist. Welcome. Ate Brigini from Italy. Welcome. Pasantra, how are you doing? Let's scroll down. Good evening. Good evening. Sharon Weber, she's got Graves' disease. Tell us more. Vicky Berner, I joined and realized I'm really late. I have Graves' disease and did radiation therapy with iodine. Okay, that's really interesting. So as we mentioned, that's the hyperactive version of it. Justin Boyce, underactive. Deborah Ronka, I had thyroid cancer about 30 years ago and I'm on 200 micrograms of levothyroxine and they still can't get my numbers right. Well, you got to keep trying, but that's amazing news. 30 years post-treatment, that's brilliant. Keep it up. Marin, I managed to lose 8 stones. 8 stones in weight, but my dose of thyroxine is intentional or was it by accident? Margarida, how are you doing? Felicades, how are you doing? Abracado, welcome. Paula, how are you doing? I have Hashimoto's. I'm hypo. That's Paula. So there's a lot of thyroid diseases going on. Nature's Harmony, Hypo, Graves, Alpha 1, and MS. Wow, that's a lot there. Christine DeWeaver, thanks for this chat. I was diagnosed by accident sometime during the mid-90s. I feel it never was fully treated. And in fashion, I'm without negative symptoms. That's brilliant. That's great to hear. Sulalali, hello everyone. Would kindly share on your Facebook the global virtual clinic and spread the word for the benefit of others. That's very good information, I see. Tom Hensel, how are you doing? I'm on 200 micrograms. Weight and temperature tolerance has never been the same. So even on the maximum dose, the symptoms are still prevalent. That's really interesting. Let's have a look. Georgina says on 250 micrograms. H. Barlam says, is it possible to have a normal TSH but a low T3, T4? Yeah, absolutely. So that would be, you know, an underactive thyroid. So the brain's kind of, the TSH has kind of given up, but it's a T3, T4 that we want to treat, not the TSH. The TSH is just telling us that despite the putting on the gas, the thyroid just isn't producing enough. So yes, you can have a normal TSH and an abnormal T3-4, and that would need supplementing. I hope that was interesting. Alessandra, I look forward to seeing the doctor next week. I'll ask analysis of my thyroid when I turn 40. I realize I gained more weight and feel like she's put on a bit of weight. Wonderful. I have double vision as a result of Graves' disease. My blood levels came back normal, but I can swear I am hyper. Interesting. Okay, interesting. Let me know what kind of levels you're reaching. Marin is loving the live chats, along with Margaret Brace. She's appreciating the free information. Ria C, I have thyroid appointment tomorrow to discuss the results of a needle biopsy for calcified nodules. Look, we hope all goes well for you, Ria. Robin Fader, what disorders mimic hypothyroidism? Well, I mean, nothing can mimic hypothyroidism because hypothyroidism, by definition, is the T3, T4 levels. So it's pretty conclusive, as in the lethargy, the cold intolerance, the lack of motivation, the low mood. Well, those are really they're very generic, very broad, and they can be a whole host. You've got to look at the diabetes, you've got to look at anemia, you've got to look at B12, you look at vitamin D. Might even want to also look at mental health. Is a little bit of sleep disturbance, a bit of depression part of the picture? So you'd have to do like a battery, an MOT of blood tests to see if there is another condition that's producing these symptoms and it's not all down to thyroid, especially if your thyroid's normal, but your symptoms remain the same. Let's have a look. Jacqueline Robinson from Queensland, Australia. She's enjoying the chat. Welcome. Teresa from the United States saying, having Hashimoto's hypothyroidism, does it aggravate osteoarthritis? It's interesting. So osteoarthritis is the wear and tear of the bone joints. So, you know, over years and years and years, the surface goes a little bit harder. You can develop deformities and abrasions, and it's not quite as smooth and doesn't articulate as well. But that's a wear and tear with time. What thyroid disease does is actually affects the resorption of bone. So remember in the last virtual clinic, we discussed osteoporosis and osteopenia. Thyroid disease is one of those conditions that can result in brittle bones or weakening of the bones. And so you wouldn't get osteoarthritis, but you get the osteopenia and the osteoporosis, which may make you susceptible to fractures. So the bone connection there is an absorption of the calcium from the bones increases. So we're taking out the bone from the calcium. Sean from Lake Salt City, welcome. Janine Le Monsieur saying, hi, it's the UK health system, doesn't do in-depth T3 levels. Yeah, you're right. What they don't do is they won't automatically run a T3, T4 if the TSH is normal. So there we go. Sean L from the United States. Lisa Skeen, my son has thyroid eye disease. Karen, how are you doing? I have thyroid cancer when I was 17 years of age. The doctor was shocked when the pathology report came back that the tumor was malignant, but it's all worked out well. Fantastic. Paula from Atlanta, Georgia, how are you doing? Diagnosed with Hashimoto's. Sean Loughton, hi doctor, I have an underactive thyroid. Trouble is, it's a nightmare. Wonderful. Other doctors, brilliant. Let's have a look who else we have in here. I'm lethargic, heavy, difficult to lose weight, cold a lot. That's Rhea, and she has a temperature of 89 recently. I'm not a zombie though. Brilliant. I like the humor there. I like the humor, not a zombie. Sharon Edelman, hello doctor, United States here. She's been a registered nurse for many, many years, and she's very interested in the virtual clinic. I'm glad it's useful. Let me know what topics you want me to cover in the virtual clinic. Belinda from Germany says, how common are thyroid problems and in what age group will they typically appear? That's a really good question. They are pretty common. You're talking about 5% prevalence. More common in women, and the age prevalence for women are sort of the 30 to 50. And so that's where the large proportion of it is. So we get a lot of ladies who come in and they're complaining of the lethargy, the weight gain, the cold intolerance, and they're very much concerned about being, underactive. But we've also got the ladies who are very anxious and they're very slim and they're very tense and they're like this, and you take the thyroid and they're complaining of palpitations and it's really high. So I hope that answers your questions, Belinda. Carol Garlin from Georgia, welcome. Let's have a look. So many questions. Let's scroll through. So many. Look, we're gonna take a break because we've got the large pile assist. Remember, if you want me to cover extra topics in the live chat Global Village, put it in the comments so we can cover it next week. Let's see who else we've got here. Christine DeViva, please have a chat about lichen sclerosis. It's keeping me homebound and the skin is irritating. Okay, we'll have a look at that. What alternative method to helping thyroid? I think you've got to hit the thyroxine. Why have Graves' disease diagnosed once it's been radiated? Okay, should do, yes. Let's have a look. What other questions we've got here? Lulu Cat, I have Hashimoto since 1961, type 2 diabetes, cervical cancer, a breast tumor, a benign brain tumor, mild polio when I was 2, just to mention a few. Sodium, underactive thyroid since the age of 8. Janine is saying, can you do a session on ME and fibromyalgia, please? Okay, we will. Absolutely. We'll do that for Sunday, I think. Put it in the comments. We'll absolutely do it. Karen Matsinski says, I've been on synthetics. However, mum took me off due to a cancer-related study. Heard anything about that? No, I haven't. Tell me more. Alessandra, classes are calling now. Hope you all have a good night. She's saying goodbye. And who else do we have on here? So my doctor finally put me on Armour Thyroid 180. 5 pills and 2 half pills. We're still working on the dosage, but the difference between Armour and synthetics is amazing. I've heard that a lot, Bratson 3. I've heard that Armour is very, very popular. We don't have it here in the United Kingdom, but I know that in the United States, it's a big hitter. It's a big, big hitter. I have nodules. I have nodules on ultrasound every 6 months to be checked. Quasimodos. Bridget Schumacher. That's Quasimodos. Okay, brilliant. Doc wants me to undergo radiotherapy 35 years after my surgery. Why? I think that's just to make sure 100% that it's all gone. So we're going to cut loose. Remember, we've got live chat and virtual clinic every Wednesday, Friday and Sunday. So the next one is on Friday. That's the same time, 9:30 Greenwich Mean Time. Have your questions ready. Put them in the comment section and I will bring them in the next session. I think a lot of people wanted the gut biology, gut flora, so probiotics, prebiotics, irritable bowel, inflammatory bowel. If you want any more topics, let me know. Let's go and see if we can see if the video is ready for upload. Till next time, take care, everybody. Bye bye.